Year that we have this panel. Good morning, Mr. Minister. Good morning, Madam Barmpetaki and Mr. Gkikas. Thank you for being with us. Let us try to structure our discussion on three levels: the situation in Greece, in Europe, and the world. I believe that you all see a great interest and everyone being keen to listen to what you are to say. Let me start by saying what happened. First of all, you got an assessment of the public opinion, what happens in the hospitals. What did you learn from that census that they did not know? I know that various things will be changing from the beginning of October on the health system and setting appointments. And now I raise three issues. I imagine you will address all of them. The Prime Minister also announced the Innovation Fund. I would like to give a thinking whether you think the 150 million euros is sufficient for this effort. Madam Barmpetaki already shows by body language that she's really looking forward to listen to you.
Now, as to the reform that is called self-assessment, that is to say the possibility we give to all those who are hospitalized, even overnight, at a public hospital to reply within 5 days to 33 questions and rate the quality of the services rendered the way they receive them and they perceive them. Now, this week, I think it's October the 1st, we will have a press conference at the Ministry of Health, and we will present the aggregate results from the beginning of this tool. We have several thousands of replies. We have approximately 20% participation. So 1 in 5 responds? Yes, says the Minister. International standards says over 5% you have a valid samples. We have something between 19 to 24%. Do the people who are satisfied respond, or those who have something to say? Well, answers are multiple choice. Okay, you have to answer or not to answer because we can't process open-ended questions, or it's a core questionnaire, and the results are very different. Surely the picture that the patients themselves paint about the hospitals describe a much better national healthcare system than the one that we read in various articles of the Eurostat or various media of the opposition in Greece, you see. The overall score is a satisfaction rate exceeding 70% of people who are very happy, who have received these services. 93% said that they found the doctor they were looking for. Somewhat lower at 70% is the nursing staff. And there are differences in hospitals. There's the cleanliness is 60 to 50%. The food, 50 to 6%. There are no indicators that are not low. There's one that was at 15%, 1.5. That was and still is the indicator of whether the patients are sufficiently informed regarding their rights after their discharge. It's something that we saw in the indicator. As of October 1st, in the hotline 1566, we have trained people to inform the citizens about their rights. It's free. It's a free hotline. It is funded by the Ministry of Health, trying to, rectify this weakness we detected through the questionnaires. Now, this tool is a complex one, you see, because we go into specifics and we try to find why does this hospital have a lower score in food or in nursing staff, and we try to do a better management of the system from within. The overall picture, the general picture, is good. I should like to open a parenthesis. However, this picture is not the same in the Eurostat report. Yes, I will get to that. I'm not trying to dodge any questions. The picture is good, but for me, in health, 100% of the patients need to be satisfied. I'm not glad with 70%. Even if a single patient says they didn't find the treatment they needed, it's a problem. But it's not this picture of total catastrophe that is presented. Now, let's go back to the Eurostat. I tried to look into this indicator slightly this year and to understand how they come up with it. The result is irrational, okay? To say that someone in Greece didn't find treatments, why? For financial reasons? Everything is free in all public hospitals. And Greece is, we give it away, one could say. Now, if someone tried to go to a private hospital and said that they're uninsured, they need to go to a public hospital, yes, this may have happened. And it's reasonable. Could someone say that they couldn't find it due to distance? Well, if someone is on an island, yes, it would go without saying. So if you ask people who are living on islands, yes, you will receive that reply. Okay, I tried to look into that, and I believe that we will do better next year. And I have an overall remark. Okay, I'm not trying to dodge the question, okay, but I know no statistical indicator. Welcome, Michalis, my colleague from the Ministry of Health of Cyprus. There is no indicator in Greece that it's sort of a poll that says how happy we are, how satisfied, how optimistic. In all indicators, we are the unhappiest people on the planet. We're the second unhappiest. Right after us is Israel, okay? They're the second happiest, okay? We're the second unhappiest. And in Greece, we're living in the country we are, and we're the second unhappiest country in the world. And this is a multifactorial explanation that is needed, and it's not a new phenomenon, okay? Now, I remember a story, because I want you to see what happens. I was a 15-year-old child, and my first contact in commerce, my late father was still alive, and he gave me the kiosk we have of the Georgiadis publications in Kifisias. We had 30 to 35,000 drachmas per day, and we made 80 to 90,000 drachmas per day. It was very big. So we went through kiosk, and the people asked, how did you do today? And my dad said, awful, awful. And I asked my father, why? We made so much money. Why did you say awful? He says, my father said, are you crazy? You must always complain if you're a tradesperson. Now, I'm interested in the real indicators of health. The first is to reduce the waiting time. The second is if we help more people to reduce the time of hospitalization, to reduce the average time of hospitalization of heavy patients like the oncological patients, and all these indicators that are recorded in a way that is indisputable, because the BI of the Ministry of Health is electronic, and we have everything written down. So we're doing much better in everything. There's absolutely no problem. Now, I can see that the NHS of this year, compared to the one of 10 years, would be a shame to compare it. If someone's comparing it, it's either a liar or is malevolent. We have more staff, more capabilities, more buildings, better buildings, more treatments, more protocols. It is a lot better. Is there room for improvement? But of course we have, because we have dreadful weaknesses. Now, again, this is a question whether we have sufficient doctors. I mean, if we see how many people who need to be hired as per the union, we need another 300,000, okay? 300,000 people. We have 24,000 people now, and they want us to hire another 300,000, okay? But I've never been in a public service and not hear the staff saying that we're understaffed. What is the ideal number for the NHS? Again, it's not a tricky question. It would be irresponsible of me to give a response right now. Medical needs are on the rise. Why? Because we have an aging population. If I say that we have more doctors than 2019, it's true, but it may be inaccurate. It may be true and inaccurate, because as of between 2019 and now, it's been 6 years, and we have a population that is aging for the past 6 years, so it generates more needs. So we need even more staff. Now, within these 6 years, new treatments arose, so we have new clinics that were created. So you see, it's not as easy as that, just a number. If I were to classify or rate our shortcomings, I would put first the shortcomings and the lacks we have in nursing staff. And please allow me to answer, okay, because you put a lot of things on the table. To paint a picture of progress and how digital technology helps us is something that I will say and help our friends who make the reports abroad. When I took over the Ministry of Health for the second time, one of the many problems we had was the problem to make an appointment for free with a doctor who is a public doctor. The average waiting time was 3 months. It was manual. You rang and someone tried to find when to make an appointment. We created the platform. The AOP and the Medical Association of Greece took us to court. They lost. Now, luckily. Now, the platform is on the mobile phone. I hope that everyone has downloaded this application, My Health. Well, I had to update the My Health application. Well, please do not hold this against us. It's an application. It requires updates. Okay? I accessed it right now. If you haven't downloaded it, do that and go sue yourselves right now. This is how useful it is. Sue yourselves if you don't have it on your app. Now, through My Health app, you can make an appointment in 3 days. It used to be 3 months. It's 3 days. Okay, this is not just an improvement. You see, it's a breakthrough. Second problem: how long does it take to make an outpatient's ward appointment in the morning? Okay, not in the afternoon, the payment, and free. If you ring 1535, which is still operational because it is the 29th of September rather, if you try to make an appointment with a gastroenterologist with the Yenimatas hospital, it will be 3 months. As of October the 1st, Wednesday, all hospitals in Greece will have to have their appointments on the platform, either My Health app or Find Doctors or 1566. We didn't just upload all appointments, we tripled them. Why? Because each hospital gave their appointments, they would give the time to have 3 million appointments, but now that we know how much time they have, how many doctors they have, how many slots they need to give us, 3 million appointments became 10 million appointments. So as of October the 1st, we will add to the available appointments 3 times as many. So we'll see, as of October the 1st, how fast they will find a gastroenterologist in the Yenimatas. I believe that the time will be shortened. In the CAT hospital, that was the first time that was connected as a pilot project, they managed to make an appointment within 24 hours. And it used to be 4 months waiting time. So we will have a tremendous reduction of waiting time for appointments in hospitals. There's a tremendous reduction of waiting time in the OP, over 50% drop in the hard number of the waiting list for a surgery. Was 4 months in the so-called cold surgeries. We have 88,000 waits for 4 months. That was January 24, and now it's 31,000 in September 25. So we have an over 50% drop in a very hard indicator, which is a shocking improvement to the system. So we're doing well. As I said before, if I had a couple of billion more, I would do more. And I wouldn't say that if someone gave me that money, I wouldn't take it as the ministry and use it. I would be a liar. I can see Michalis there. If you say, can we compete with Cyprus in terms of doctors' fees? We can't. I don't know how our brothers and sisters in Cyprus make it and can do it. We can't. Okay. Now, the Innovation Fund. Well, the Innovation Fund didn't come out of thin air. It came here to cover a problem. I'm not painting everything white. We have many black spots. Greece has a relatively high clawback, considerably higher than the European average. The large multinationals that produce and create the very innovative treatments wouldn't put Greece in the first list of countries that they would bring their countries. I understand that. There are other countries, other markets that have lower clawbacks, so that means greater profit for the company. I understand. So the Greek patients may find contact with those treatments through the EFED. It's time-consuming and it's not always successful. So it creates an uncertainty as to the speed of access to innovative treatments for Greek patients. It's not tragically low. We're within the European average, but we are lower than the best. And I always want to compare myself to the best, not the worst. In a discussion with the PIF, we had the idea of the Innovation Fund. Now, whether 50 million will be enough, the correct answer is yes and no. We will have the first applications, okay, because the Euro Investment Fund, it's not just another 50 million that goes in a bucket, okay? It's more complex. It's 50 million that for a drug to be introduced that must be innovative, it must meet the requirements of innovation, and it must prove its treatment efficiency and effectiveness, because if it does not prove it within 3 years, if it doesn't show that it prolongs the life of oncological patients as promised by, say, a year, and what we got is worth getting, it will no longer be in this channel. It's much more convoluted and complicated. We spoke with the Prime Minister and we said, let's introduce 50 million as of the 1st of January, and Mr. Georgiadis helped us with the survey we did with Price, probably PwC. And if we see that 50 million isn't enough, well, our Prime Minister is not indifferent. Okay, it is his personal commitment of the Greek Prime Minister to have the Greek patients to have access to innovative treatments faster. But please, so you know, there are no easy solutions in pharmaceutical policy. The challenges for budgets for our country and the other European countries will increase. Those challenges will increase. They would have increased even before the new US administration, and they will definitely increase with any new interventions by the US administration, the new US administration. So the problems will be more difficult to handle and manage, no matter how many good ideas we will receive. And I would like to welcome the former Minister of Health of Belgium, who did us the honor to have been with us. So the Minister gave us a preview of what we will be discussing in the second round, the new policies by the American administration, what happens at the European level. Mrs. Barmpetaki, Labrina, the Innovation Fund pertains particularly to the pharmaceutical industries, and I would like to hear what you have to say. As of January the 1st, 2026, it will start, and Minister said that we are open to availing more funds.
Thank you, Mr. Mangiriadis. As far as I'm concerned, let me start with another statement. The pharmaceutical policy and solutions are not easy to find, but allow me to raise the issue of Innovation Fund and place it in a framework of a more generic discussion we conduct with the Ministry of Health, so as to have this magic three-faced framework we want for innovation. That is, to have predictability and something that will secure the sustainability of these treatments once they reach our country. So I'm not solely interested to have these two induction period. I'm interested in the overall policy. When 1 year ago we started a discussion with the ministry exploring the idea of a framework agreement between the industry, pharma industry, and the state, something that was signed in Belgium, for instance. And actually, we have discussed with the former Belgian Minister of Health how she introduced this framework: innovation, R&D, studies, work. This is what I want to see. I do not want to do cherry-picking innovation fund, because this is one of the ideas which we, of course, want to support. We were the ones to propose that to the minister. We spoke of the need of having a different system for certain treatments, but let me reintroduce the overall discussion, the overarching discussion that is for all companies, all pharma companies, and new treatments introduced. Now we speak of extremely sophisticated treatments, second and third degree, gene therapies, we speak of cancer and access to treatments that indeed prolong life expectancy, and all that is the benefit of the patient. It's not merely to have the budget. The patient is in the foreground. This is what unites us all. So in this framework, we cannot limit ourselves in one measure. We must see the overarching framework. We had a discussion with the minister, and if you allow me, let me share the highlights with the audience here. We have not yet attained what was desired, so as to be able to have economies when we have alternative treatments, so as to divert resources in those fields where there are no treatment solutions. This in a limited resources system, and no state has limitless resources. One must make choices, budgeting, funding, but as we have shown, the innovation framework must be measure bundles, if you like, because this is where development would have, this is where that budget should be allocated. And we should also have a second framework of direct and more easy access and an acknowledgement of this innovation, treatment innovation. I will not disagree with the minister that we have to measure, because data demonstrate this is how we can find a solution, whether a treatment solution reaches the right patient at the right moment with the right alternative. I absolutely concur. But in a framework of the high paybacks, which not only set us apart, we are the absolute outlier in Europe. And this can be clearly seen from all studies conducted by FPR and elsewhere. All that is public. So when we speak of a payback, which as far as innovative drugs is related, and has been published that they reach a 79%, and for the AOP medication, 68%. This is definitely not satisfactory. I know that the minister is not satisfied either. So I would qualify the Innovation Fund as a new commencement, as a good first step. But most importantly, we must have a cutback on the various refunds, so as for the clinical trials and all the other activities could be guaranteed. So, succinctly, Innovation Fund is a good commencement, but this 50 million euros is a good original idea. But let us also link it with the Horizon Scan study, because this will demonstrate whether this suffices or not. So we must see what lies ahead. We must assess what we miss, what is the opportunity cost, what we cannot have as innovative solutions in Greece, and then decide whether this 50 should be 50 or 100. Many times, furthermore, now we enter the process speaking of other channels. For instance, IFET has also offered solutions, but as far as we are concerned, innovative industry, IFET is not the access channel for the patient. It must be used only as an exemptionary course. When we speak of prevention, we must have the study of the epidemiological data. So I conclude that in the framework of our cooperation, Innovation Fund is just one of many ideas. We must also view funding. What are the figures giving the real uncovered need that we must cover? And once again, I reiterate, in view of de-pressuring towards the right direction of those rebates. When we speak of more than 50%, it means that there is no co-responsibility. It seems that we take more of the burden. This the ministry understands and has shown signs that they want to correct it. So the first year that we'll have less rebate, that will be the first step to a good journey. Thank you. Mr. Gkikas, now, let us take the viewpoint of the diagnostics companies. How can secure that the investment made in the medical device and diagnosis, that there will be no waste, that it is well allocated, and all those installations are well maintained? Let me start with the acceptance that today we have indeed huge changes, a series of projects of funds are being funded by the Recovery Fund, and it's a good opportunity for all. But we should pay heed not to fall in the trap that everything changes so as to remain the same. So indeed, our hospitals will change, will be modernized, but what we must definitely secure is how we also change the way we offer services to the citizens. So we must view how this whole technology, medical devices that will be state-of-the-art and introduced in the hospitals, how they offer a new path and not just an array of devices, one next to the other, as perhaps happened in the past. We heard that we now deal and we see ailments holistically, that is, we see all fields. medical devices have a role to play in this process. And we should secure that when we make this investment, that they will indeed serve this need, that they put the patient at the center and will serve in a way that the new technology, one technology will complement the other, and there will not be an overlapping causing a redundant expenditure. This is one of the issues of concern, which we discussed with the ministry. That is this new design, the new investment, that we do have the opportunity to have funding from the RRF, that they eventually will bring about a modern reform and is in tune to what happens globally. This is one part. The second has to do is that medical technology evolves on a rapid pace. Every 6 months, we've got a new discovery, and we'll see over the next year, discoveries that we didn't see for the past 50 years. AI is the huge opportunity and opening for the future. So one of the subjects that we must see is how we secure that this will be appropriately maintained, that we do have the resources to maintain that, but especially to renew it and have updated. It's useless to have innovation that will be obsolete within 3 years. So we must see health paths, and we must see that this technology will remain modern and state-of-the-art even when introduced in health units. This is something that we discuss with the ministry. And with our presence here, the biggest companies in the world are based in Greece. They have affiliates in Greece, and they can really assist so as to make well-targeted and well-planned and designed investments in technology. Thank you. We have time for a last question, Mr. Minister. We must speak about innovation and the situation in Europe. Those who read the Draghi study, we saw how much it asks for investment in health, and there's now something given in the in the USA with the most favorable innovation that President Trump has announced. Now, you came from the Council of Ministers, Health Ministers, that took place last week in Copenhagen. Where are we currently?
Well, first of all, Europe in and of itself is lagging behind in innovation. 20 years ago, Europe had about 2/3 of the new drugs that the US produced. China was almost non-existent. 25 years later, Europe has 1/3 of the drugs produced by US. China is in between. The Americans go up, Chinese do so, Europe goes down. So the European policy that we followed in 25 years didn't work out, okay? It's the numbers, it's not me who say so. Second, this policy did not work out, but the discussion in Europe was even worse at the time. The big discussion we had about data access, data protection, and the reduction of patent times and patent life as compared to the rest of the world was a very rather wrong message to the pharma industry that led to more divestment in Europe rather than larger investments. I wouldn't want to go into the intra-European discussion as to why that happened, but that was the case. Now, luckily, and Greece played a great role, and I could as well, following our Prime Minister's orders, we kept a very firm stance in the European Council in favor of innovation. And this was recognized by the industry and by other colleagues, and it's a given fact that Greece held fast. We stood our ground as to not to make innovation environment more difficult for the industries as it was in Europe. And this is a battle that we tend to feel that we're going to win for now. Now, we still have to go through European Parliament and everything, but at the level of the Council and the countries, I believe that we have come up with a reasonable agreement that was achieved during the previous presidency of Poland and now under the Danish one. Now, the good thing is that Europe realized, albeit late, because the policies of President Trump may feel a bit brutal at times, but they have positive impacts. One such positive impact would be to wake Europe up, because we were asleep. We wouldn't have this if without Trump, or the trends in innovation without Trump. And Europe realized that everything was not rosy and peachy and hunky-dory, okay? And that Europe is not the center of the world, okay? So things started to change, and gave me great pleasure at the latest Ministers' Council we had in Copenhagen last week. We discussed for the first time in the EU, this is something unprecedented in all these years, how we can create what we can to bring more trials in Europe. So we said that, well, pharmaceutical industries need some initiatives and incentives to come here, and they need to make money here as well. Okay, and this is a good thing, because Europe was always on the flip side. In this, Greece played a great role in the Council, and I'm very proud of that, because one of the greatest problems we inherited from the previous frivolous times was, back in 2022, something that's called Urban Wastewater Management Directive. Urban Wastewater Management Directive, if implemented, and it is expected to start as of 2027, it will shut down half the pharmaceutical industries in Europe. Okay? No one who can leave won't, okay? And we saw this in Greece. No generic drug industries can survive. So it was the Ministers of Environment that said that the fourth level obligation of water management using new technologies that are very, very costly, and with the obligation to burden 80%, shoulder rather the 80% of the cost. That's something that is determined by the countries, and the clawback is very high. So it's madness. It's madness. So I raised this issue with the Council off the agenda, and many of the countries supported me after my speech. I didn't discuss, and 6 ministers agreed with what the Greek minister said. The chairperson, the Danish health minister, said that the discussion will start at the EU Commission officially, and I will raise this in December in the next Health Ministers' Council, because we need to rush and hurry, because 2027, send the message to the industry, please don't leave, because 2027 will not be as you're afraid it will, because no one will start leaving in 2027, they will start leaving in 2026. So we need to put the pressure on the Ministers of the Environment and to explain to the European Parliament and everyone that the whole world does not revolve around Europe. We are competing against other countries and on the planet with other costs, China, India, the States, and we can't do whatever we feel like in the EU and whatever appears as moral and virtuous or whatever. So, I believe that Greece will play an additional role in this in favor of innovation and investment in pharmaceutical industries. In conclusion, I would like to say that I don't know what President Trump will decide next. I think no one in the room does. If anyone has a hint or an idea or inside information, please share it with us. So, as soon as the new American administration decides exactly what they want to do, and I hope it will be substantially different than what they wanted to do in the beginning, if they insist in their initial plan, which is for each company to declare the lowest selling price in any European country, or at least in a country that has got the 6% of the GDP, etc., whether it is clawback or an agreement or a rebate or a price list or whatnot, if this really comes to pass, and if it comes for innovative drugs that are to be introduced, I can surely say that we'll see one innovative drug per year in Europe, and that may be too many. If they try to implement it ex post, then I really have no idea what will happen, to be perfectly honest. I think that all ministers of health and all ministers of finance will just have to sit around the table and talk about different numbers. We're talking about different budgets. It's got nothing to do with whether I can take measures, come up with protocols. It's an entirely different environment. Okay? So when this decision comes, please invite me again to say what I think then. Now, I imagine that all these things are under negotiation. At the end of the day, we're all reasonable people, that I believe that the policy that will be implemented will contain elements of realism for everyone. Okay, I don't believe that the US government wants to leave Europe without drugs, okay? And we don't want to enter a global health world of insurmountable dimensions. But if you ask me, as the health minister, whether there is any health minister in Europe that we will not get a drug and let our patients die, this will not happen. Well, this was quite stressful, Minister, so this leaves just 1 minute for Mrs. Barmpetaki because we're out of time.
Oh, I'll take the thread from where the Minister left it. Definitely something has to be considered. As Greece and Europe, there's a choice to make, and in the next weeks and months, it will depend on what decisions will be made, on what we will be doing. I will not reiterate what the Minister has said, but definitely we consider that supporting an environment where Europe does not merely regulate is something that has to be done. This is number one, because until now we just have been witnessing USA and China developing and Europe merely regulating. But I would like to be even more daring. Yes, it's true. Over the next weeks, we will be in front of important decisions regarding pricing. And the Minister very appositely said it's not only an issue of what appears, but what is the structure of a pricing system with all the cost containment measures taken. We are quite innovative in that as well. That is, introducing measures, doing the summation and automation of measures, which at the end of the day strangulate innovation. So we'll be called upon to make these decisions. Biotech Act, which is currently discussed, does not solve the problem. There are radically different decisions have to be made. That is, what part of a country's funding will be allocated to innovation. Otherwise, we will just be crumbling, feeding ourselves on crumbles. We must also see some other measures so as to promote access to innovation. The HTA must be done in a way that we will promote access. That is, not to waste months and years. So, in the next weeks, you will be discussing very important issues. We have a choice. We haven't missed the opportunity, but we must be more daring in innovation funding and protection. Would you like to conclude, Mr. Gkikas? Yes. Funding, pricing, innovation. There are two channels. Through public sector, we've got public procurements and so forth. We must become far more daring there, not merely assess technological characteristics, this traditional model that is, and move to effects, that is, see the dosage, the patient's comfort. All these things are important so as to have the patients do a good ranking in the assessment. Now, as far as the second channel is concerned, that is the private sector, is to offer incentives. We cannot have a private supplier to invest in something innovative without being dispersed, without being paid. This is most important. We will be missing innovation. So our proposal is to view this holistically. We have the innovation. I told you, we construct wonderful devices, and we want to offer them here for the Greek patient. Thank you all. Thank you, Mr. Minister, for this initiating discuss. Then we have Mr. Moskalos with Mr. Pavlos Tsima.